Perthes disease is an extremely rare childhood hip disorder that is initiated by a disruption of blood flow to the femoral head. Due to the lack of blood flow, the femoral head is deformed, causing the bone to weaken and essentially the bone cells die, which is called avascular necrosis. Dr. Perthes took the very first x-ray of a patient with this newly discovered hip disorder in the early 1900s. Around the same time, Dr. Arthur Legg, an American orthopedic surgeon, and Dr. James Calve, a French orthopedic surgeon, also published findings about this disease. That is where the name Legg-Calve-Perthes disease comes from. LCPD is a chronic disease that begins occurring in children from ages 4 to 10 and is something they have to live with for years. But eventually the blood flow returns to the femoral head, but some problems will still remain even after the blood flow returns. Doctors do not know the exact reason that LCPD happens. All they know is that for some reason there is limited blood flow to the femoral head that begins at a very young age and returns later on in life. They do not know, or they do know, that LCPD is more commonly seen in males than females and all of the effects of this disease. The effects of LCPD are constant, intense, and sharp pain, slowed growth in the affected leg, the difference in leg lengths can be up to 1.5 inches, bone fragments in the hip socket, probable hip replacement at an early age, impingement of the hip, very limited range of motion, malalignment of the spine, shoulders, knees, and pelvis, avascular necrosis, deformed femoral head and hip socket. All the effects of LCPD are related to each other in one way or another. Malalignment of the spine, shoulders, knees, and pelvis is caused by the difference in leg lengths. Avascular necrosis causes limited range of motion and the reason for a probable early hip replacement. The constant intense pain is caused by the impinged hip and the deformed femoral head grinding inside of the hip, which leaves bone fragments inside of the hip socket. The leg length discrepancy caused by Perthes disease is only in the upper leg, or the femur, because of the limited blood flow to the femoral head in that area. The difference in leg lengths can be very hard on the rest of the body because you are constantly trying to overcompensate other parts of your body, which causes pressure on your knees, worn out cartilage, uneven weight distribution, and a noticeable limp. There is little treatment you can do for LCPD. The only thing you can do is try to limit the effects by improving range of motion, getting a heel lift to distribute weight more evenly, stretch every day, run and be as active as possible, and eat nice.